maternal mortality ratio. So to ask a few questions, the first one being, what is the definition of the maternal death? Next, what is the formula for the maternal death? Next, in case of the maternal death, what are the most common causes? So we'll find out the answers to these. So firstly, the maternal death, it is defined as the death of a woman. It is defined as a death of woman while being pregnant, or within the 42 weeks, within the 42 days of the termination of pregnancy. So here it is irrespective of the duration. So duration is not considered, as well as the site of pregnancy, and from any cause related to or aggravated by the pregnancy or its management, but not accidental or incidental causes. Not accidental or incidental causes. So now looking at the formula, the MMR is equal to the number of the maternal deaths by the number of live births, and this is to be multiplied by 100,000. Next, we look at the global causes for the maternal deaths. So the global includes, there is, in case of the severe bleeding. Next, in case of the indirect causes. So the indirect causes, it includes the anemia, next also the malaria, as well as the heart disease. Then it also includes the infections, the unsafe abortions, as well as the eclampsia. Next, the obstructed labor, as well as there are some direct causes, and this can include the ectopic pregnancy, as well as the anesthesia related complications. Now looking at India, the most common causes due to maternal death is due to the hemorrhage, and this is nothing but a leading cause. Next, there is also due to the sepsis, obstructed labor, and the hypertension disorders associated with pregnancy. So now to answer the question, firstly, what is the definition of the maternal death? So maternal death is nothing but it is defined as a death of a woman while being pregnant or within the 42 days of termination of pregnancy. So within the 42 days. So within the 42 days of termination of pregnancy, and it is irrespective to the duration, that is irrespective of the duration as well as the site of pregnancy. And other thing to note is that from any cause related to or aggravated by pregnancy, or it is management but not from the accidental or incidental causes. Next, the question was, what is the formula of the MMR? So the maternal mortality rate is equal to the number of the maternal death. So this is divided by the number of live birth, and this is multiplied into 100,000. Next is, what is the major cause of the maternal death? So the major cause of the maternal death, this is nothing but, it includes the severe bleeding as well as indirect causes. So the indirect causes, it includes anemia, malaria, as well as the heart disease. Next, infections are also included. Unsafe abortions, eclampsia, obstructed labor, as well as other causes. So this includes the ectopic pregnancy and the anesthesia related complications.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.